At Hawkhurst Community Hospital, which mirrors a lot of the hospitals around the county, we're a 22 embedded patient unit. We have a multidisciplinary team made up of nurses, healthcare assistants, physios, occupational therapists, social services, and we all come together to ensure that the care of the patient is as seamless as it can be so that we can get people home or to an appropriate place as quickly as possible.
We deal with mainly the older generation, and we specialise in Parkinson's, motor neuron and palliative care, and we treat everybody as an individual here.
Well, I've only been here for the past 2 months, and so far so good. The introduction that I had, it was a 5-day introduction, I think it was. I just got good vibes from the matron, the sister that were interviewing me, and also when I had a look around the place as well. You can tell from the first time, just a general warm feeling from it. So
my work in the hospital is basically to cook dishes as good as possible for the patients, homemade dishes, and to provide all the catering services around it. At Hawkhurst we do things a little bit different than in the other hospitals. Me and my team, we're serving all the food, we're dealing with every sort of aspect of catering work in here. The nurses, they can stay on the floor, they can do their own jobs, they don't have to serve the food or worry about the food.
I'm a domestic supervisor, and I'm in charge of the other cleaners that work here. And our job is obviously involved in keeping the cleanliness of the hospital. We've got really high standards, and we like to clean the hospital like we would our own house.
As a sister's role would be to make sure the ward is staffed well, and that the hospital is clean and tidy, because that has a big impact when people visit him. I know when I came here 5 years ago, the first thing that hit me was how clean the hospital is.
I do laugh a lot, and I think that's very good therapy, really. And a patient does enjoy confiding in you as well. And sometimes, like the other day, a patient actually felt rather low and they actually asked me for a hug. I was actually quite taken back with that, and for me that was my bonus for the day.
I think people would be really surprised what a modern day matron really does. The old view of Hattie Jakes on the wards in the Carry On films doesn't really do it justice anymore. I actually run the whole hospital, so to speak, so my responsibilities involve the kitchen, the chefs, the therapy departments, the nurses. I hold a budget. So I'm pretty much running, or I'm in charge of the whole of the hospital, which I think a lot of people would be surprised at, because matron still has that connotation of being very clinical and being on the ward, so to speak. But I think the whole premise behind being a matron is ensuring that standards and quality are always maintained. And it's about, you're the guardian of safe care and the guardian of patient safety. And it's about how my whole daily role is really ensuring that I interact with the staff on a daily basis.
Part of my role, obviously, is to look at how they manage all their everyday living, really, like washing, dressing, cooking, cleaning, social life, really care needs, you know, how they generally manage at home, up and down the stairs, in and out of the bathroom. Anything that you do daily, if you've got problems with when you're unwell, then it's my job to come up with ways to help you do that.
just basically I wanted a job where I'm actually making a difference to people's lives, you know, whether it is a big change or a little change, but just going home every day and knowing that you've made a difference to someone's life, that was just ticked all the boxes for me, basically.
I came here 8 years ago as a staff nurse, and I was promoted approximately 4 years ago as a sister. I chose nursing because obviously I feel like, yeah, I'm a caring person, and I like to think I'm helping people. It gives you satisfaction when you see people improve, and people are getting older. We're in a world where people are getting older all the time, and actually people can still go home well into their 80s with support and remain in their own homes.
I think for me, becoming a nurse was probably something I was always going to do. To be a good nurse is to really make sure that you understand and carry out the fundamentals of just being compassionate and empathetic and caring.
I feel I have made a difference to individuals. There was a young person, he was terminally ill, he was only in his 40s and that, and we laughed and we joked, and I made his last few days really, really happy. And when his friends used to come in, they used to get on the weighing scales as well. And then he went home, and obviously he passed away, and his brother came in to see me one day. I spoke to staff nurse and I actually asked for time out. I felt that he needed just to talk to me in private. And he explained he'd just come back from a funeral. He sat and cried with me, and he actually said that I made the last days of his life memorable and he would always remember me. And I was so grateful for that, you know, because it's nice to know that you've made a difference to someone. Because hopefully somebody will be there for me one day.
The ethos behind Kent Community Health is about treating patients as close to home as possible. And this may mean that you're being cared for within your own home by the district nurses, rapid response teams, or it may mean that you have to come into a community hospital like Hawkhurst Community Hospital.
Bottom line is, our task is to send the patient back home, fit and strong, and to go back home. You can give him what sort of drugs you want, but the bottom line is he has to have a proper nutrition as well. If he's not going to receive that, he's not going to be managed to go back home healthy. That's the bottom line. And in here at Hawkhurst, we are talking with our patients, we're meeting with our patients, we're listening to them, what they have to say, we're meeting them expectation. For example, if the patient's going to require some sort of a special diet, like diabetic patients or celiac patients, we obviously doing that for them. But it's not just that. If they're going to require a special meal that it's not on the menu and they like it very much or something, we're always here to do it for them, and yeah, that's not a problem for us.
The fact that the patients now go down for lunch, it makes it more of a homely sort of feeling, and also it would help the patients probably get better quicker, in the sense that they are being motivated and they're communicating with other patients. We have daily newspapers that are put down there in the day centre, so when they go down there in the morning or to have lunch, it keeps their minds, you know, about what's going on in the outside world if they choose to read, if they choose to read the papers. The room we're in at the moment is the contemplation room, and there's music playing if they want to just sit and be quiet for a little while and think about, have their own thoughts.
The whole ethos at Hawkhurst is teamwork, really. And I think because it's such a small hospital, it works really well. And the whole team, from the domestics, the catering staff, nursing staff, admin, social services, we all really sort of gel quite well, and the communications, which I think is brilliant for the teamwork, works really well.
Nobody really wants to be in hospital, but there comes a time when unfortunately that has to happen. So our role is to support that patient and to work in partnership with them and their family to get them home as quickly as possible so they can be with their loved ones.
It's just trying to listen to what the patients want, really, and try. I mean, a hospital, obviously everybody wants to be home. That's the best place if that's where they want to go. But obviously sometimes that's not possible, so we try and make it as best we can. And if they need to go somewhere else, to make that an easy passage, if you like.
But another factor I would have to say, here at Hawkhurst, we work very well as a team. We have very exceptionally good healthcare assistants, and it's not just about a nurse on their own, it's about everybody pulling together. The more you pull together as a team, the better care your patients will get.
I heard a story a while ago, many years ago in fact, about JFK, the president, visiting the space programme, and he come across a janitor and stopped and asked the janitor what he did, and he replied, "My job is to get man on the moon." And that has stayed with me forever, because it was just like, wow, everybody knew what the goal was. It didn't matter whether you was the astronaut or whoever, everybody knew that the whole goal was to get man on the moon. And so wherever I've been and wherever I've been involved in teams, I've always tried to ensure that everybody understands their role in quality patient care. So it doesn't matter whether you're the receptionist, whether you're the domestic, the chef, the matron, you all have a role to play in that patient's journey, which is really important.
Serving up the good food for the patient plays a big part in the recovery of the patients, because that helps them go home quicker and recover faster and get them back on their feet.
I'm just really happy and I'm really enjoying my job.
I've worked at Hawkhurst for 10 years and I really love the job. I take great pride in the hospital, and we always get told that the hospital looks really nice. So it's really nice that obviously we do get feedback from lots of the patients. They love the hospital because they know they're going to be well cared for here.
So I think people would be really surprised about all of the things that come together within these four walls to get people home and well. So yeah, I think it's a great place to work for if you really want to feel that you're making a difference and you have a voice that can be heard.